Welcome to Tea Time with Dr. K, where we share stories that inspire transformation, celebrate victories, and dive deep into the journey of health and wellness. Grab your tea and let's build a better you, one conversation at a time. Thank you for joining us for another episode of Tea Time with Dr. K. We have sweet Chris here today. Thank you, Chris, for joining us.
Thank you for having me.
Of course. And as you all know, we love to have our patient come to our practice, talk about their dental experience, how they found us, what did they think of us. And so I'm going to let Chris take over and let us know how he found us to begin with and just a little bit of the journey. And how do you feel about the practice and the team?
Okay. I'm Chris. Nice to meet you all. I have been searching for a dentist for a couple of years, searching around Frisco, also McKinney, looking in the Allen areas just to see,
Searching the world, man.
Searching the world, yeah. Even looked overseas, Mexico. You always see all these things on the internet about, the procedure with dentals, with dentures and stuff like that, or veneers, like everybody's going into all over the world. And they say it's cheaper to go here outside the U.S., but I kind of wanted something back at home. Where if I had an issue or, I had a bad experience, I could come back, and actually it'd be somewhere that's right down the street. So stumbled across this great place here. Met her about a year or two ago.
Yes.
Great experience. When I first walked in the door, I was loving the place, the decor in the place, the architecture of the building. It looks beautiful in here. Also, everybody's friendly, very loving. Just make you feel at home, make you feel good. And it's just something I couldn't pass up. So I was nervous, but I couldn't pass it up.
How did it make you feel?
Like $1 million. Like made me feel good, make me feel welcome, and it's just the type of culture I like to be around.
Well, I appreciate you. And, we understand that many patients, they have dental anxiety and they don't want to go to the dentist. But understanding what the patient's needs are and wants, and also creating that environment that you feel safe and heard, I think that's what most patients strive to seek or feel. And I feel like that's what we were able to do for you as well. Yeah. And, Chris is a little, I would say, reserved. Mm-hmm. But this is not something that he would normally not do, but he was very kind to accept my invitation to the podcast, and I so appreciate you.
No problem.
So, Chris, do you mind sharing with our audience what kind of dental procedure you were seeking to receive, and what did you actually receive in my practice, and how was it during the procedure and even after the procedure?
Okay, sure. I was coming to get some dental implants. Like I said, I had been looking at veneers. Then I was just like, well, veneers, I heard good and bad things about them, depending on where you went. So I came here and I was looking at getting a couple replaced implants. I actually got 3 implants, 2 on one side, 1 on the other side.
Yeah. Yep.
I was
strong bone, didn't you?
Yeah, strong bone.
I don't know what his mama fed him as far as growing up. I think it was a lot of milk because it was some strong bone. Usually in the top back areas, you have the softest bone out of everywhere else, like right at the front and the sides. But boy, you have some strong bone. Yeah. I remember saying that during the procedure as well.
Yeah, a lot of milk. It's a lot of us. I actually got 11 siblings, so I must have got good.
Then you have to take care of you all well. That's great.
Nah, but it was a great procedure. I was nervous about it. I was very nervous that morning and the morning of, but I'm glad I did it, I still got some more dental work I want to do, but definitely would recommend this to anybody. You were very calm with me. The patience that everybody had and the friendliness, just making sure that I was good, because my blood pressure, I think, was going up. I was like very nervous. I was like, why is my blood pressure up? But new experiences. I mean, a lot of people, you hear these horror stories about people going to the dentist because the pain with it, the pain associated with it. But you know what? I'm glad I did it. It boosts your confidence, make you feel pretty good. So
definitely boosts his confidence, that's for sure. We're gonna cut for a second. Tell him to stop vacuuming.
Oh,
it's because I talk a lot at work too. So
yeah, I do a lot of meetings and presentations. So
ooh, look at that.
Yeah, it's just like I just get in the flow after that.
So I'm going to say something too. Chris, you're actually wearing a Copyplast.
Yes.
A clear aligner. So when we place implants, we don't want any teeth shifting on either side. So we actually deliver a Copyplast, like a clear aligner, so that it's kind of like an Invisalign tray with a tooth in place, so that the missing gap is kind of like covered up. so nobody really sees when he speaks or talks or laughs. And interesting, you received it like 2 days ago.
Yes.
And you're actually speaking with it right now really well.
I've been practicing.
Yeah, that's great. And the more you practice, because the very first time you receive it, it's kind of like, I know you were trying to give me a video testimonial, you were lisping a little bit, but in 2 days, I think because you talk a lot.
Yeah.
And it's the funny thing is that I actually didn't think he talks a lot, because when it comes to my practice, he's very reserved, very quiet. And then now he's doing the podcast where he's talking, I'm like, oh, he actually speaks. And then he says, no, at work I give presentation and stuff. I'm like, I understand now. But how many hours did you wear it for you to get comfortable? Have you been talking with it the last, 2 days, or what have you been doing?
Well,
it doesn't seem like you have anything in your mouth on the top.
Well, I've been talking with it. I wear it all day. The only time I take it off when I eat.
Yeah.
I make sure I'm cleaning the retainer out.
Yeah.
And after that, I'll replace it, and then I wear it until I go to bed.
Yeah.
So I make sure I'm doing the salt water. I'm brushing well and flossing and things like that. So I just wear it regular. So I have to talk at work, and sometimes they tell me I talk too much at work. I had to get.
You just knew it.
So I'm gonna get used to this because this is gonna be my smile. I'm just gonna be my smile. So I got to get used to just wearing that and walking around with it. So
that's awesome.
It just came natural after a while.
And do you remember what post-op instruction I gave you for the copy blast?
You just told me to make sure that I'm washing it out with soap and water.
Yes. Not toothpaste. Why?
Not toothpaste, because it'll fog it up. Yeah. I don't want to be walking around all foggy and stuff like that. So
yeah, it's really important because toothpaste has a little abrasive material. So if you actually use it on a clear Invisalign tray or a copy blast, then it will make it cloudy looking and makes his teeth look dirty. And I did not actually notice he had it on till I started seeing him smile from the side. I was like, oh, he actually has it on.
It's like he's smiling more.
He's smiling more, believe it or not. Because when you're self-conscious, it affects your confidence. So you're more reserved. And now that you have this on, you're talking, you're speaking, and you're smiling.
Yeah.
Funny what it does in 2 days.
Exactly. So this imagine what I'll do in 2 years.
Exactly. And there's other stuff I want to be able to do for him, but it's a work in progress. And what's important to me is that what the patient's needs are, and also the finances, because if I understand what his goals are, I can plan the case in such a way that it will take us maybe a year or 2 years to get there, but it will be done the right way. The foundation will be done correctly. And that's really, really critical, because it's not about patch-up dentistry. It's about what is it that you need or want so that I can help you in advance, build that process, build that blueprint for you.
Exactly.
Yeah. So tell me, you said you talk a lot at work. So what do you do for a living, and why do you get to talk a lot?
Okay.
So
I'm a assistant operations manager over at Nebraska Furniture Mart, Colony, Texas.
Can I get a discount?
You could always get the friends and family.
Yeah. You got the friends and family too with me.
Oh, well, yeah. Exactly. Operations manager, I oversee multiple departments. I have a boss that's me, and then I'm right up under him. Big operation. We have over 500 employees.
Wow.
So I talk with a lot of different people, a lot of different personalities, do interviews, presentations. Just started up a leadership program based out of Omaha. We got it in Kansas City. We got it in Des Moines, of course, Dallas, and we're headed to Austin as well. So that's just things I do. I'm working on a lot of things there, and it just gets me to the point where I have to talk. I got to get up there and give presentations. I got to talk in front of crowds, and that's something I was real shy, but once I got into that role and started to grow and moving up, I had to talk more.
How long have you been in this role?
In this role right here? About a year. I've been in management for probably about 10 years.
10 years. So to be in that position, to be literally right below someone who is, above you, it takes a lot of dedication and discipline. So what did you did definitely for them to notice you? Because it's about life lessons, right?
Yeah.
It's about leadership. You mentioned leadership. What is it that you did differently throughout the course of your lifetime to be able to get you to that next level of success, I would say?
I think that it talks, personally, the culture is everything. And I've actually worked with a bunch of different managers and supervisors, and I met a lot of people, a lot of coworkers, and pretty much I would try to take something from everyone. If I seen a manager that was doing something great, I said, I want to do that as well. If I seen somebody that was doing something terrible, I just I don't want to do that, because I've been with the company for quite some time, and I focus on the needs of the people. You know,
Awesome.
so that's something that
That's what you notice about us, probably. Then.
yeah, culture. That's why I speak culture right there. I'm looking at that, and our core values are pretty big at the company. So that's why I had to get that feel here. You know, somebody to make you feel at home, that you feel welcome, and that you can just be yourself around.
That's awesome. That's incredible.
Yes.
Thanks, man. And so any advice you have for someone who's seeking a dental office and looking to get a dental experience, what would you say to them if they had to say a few things about our practice, like about the team or the culture or the core values that you have seen? Because as you're in a position of leadership, you said culture and core values. And so what is it that you seen within us or me, myself, or the team that you feel like, oh, well, that thing is stand out. That's why I chose you guys, you know, or that several things that stood out.
Okay, so what I would say, if you are looking for a practice or to get some dental work done, do your research. I see a lot of, social media dentists online that actually had pretty good reviews, and I looked at them. But the more that I digged into it, I seen like some bad things there. So I was like, oh, some bad stuff in there. You know, like the reviews are saying like 4.9, but then you really get to digging for like those reviews at the bottom. I try to look at like the ones and twos and like the bad experiences. So that's something that you should look for. Do your research, and actually, word of mouth is everything. You know, so I'm here in Texas. I'm from Kansas City. But I'm here in Texas, and I can vouch for a good practice, a good experience here. You know,
thank you so much.
She's so friendly. She makes you feel at home. Like I said, it just makes you feel good. And then even her, the dental assistants and everybody in there, they treat you pretty well. You know, you come in here. This is probably the most fancy, luxurious looking dentist office I ever been to. You know, and I've been to a lot of dentist offices. But the team here, she has a great team.
Thank you.
She actually just makes you, I just can't express the welcome, you know, and very integral, you know, seem like they got a lot of teamwork here, big on customer loyalty and the focus there. They do a lot of that. So
yes,
it's just the trust is there. You know, you got somebody that you could trust that's going to do a good job with you. And then once they do it and you get the results, you know, you kind of stick with people like that.
Yes, I appreciate you for noticing.
No problem.
Thank you so much for allowing us to take care of you. He has such a sweet smile, and he's very kind heart. And so I know that you had a meeting to go to, and so we don't want to make this podcast a little longer because I respect his time, and especially when the patient come to the practice and they let us know they have somewhere to go, they have a meeting, we make it our number one priority to get that patient out on time so that you don't be late for your next meeting. So next time if I ask him for something, he'll just be there. He just knows that we'll respect his time as well.
Exactly.
So I'm going to say thank you so much, Chris.
Thank you.
So appreciate you for coming in and for sharing your dental experience with our audience and for expressing such a lovely comment and review of us. You know, just sitting here and stating how you felt, how it made you feel like a millionaire. No, what did you say?
$1 billion.
All right, $1 billion. So we appreciate you, and I'm so proud of you. And you know, one of the most important thing is that the patient have great experience because they also follow through with the post-op instruction. You know, I did ask him, hey, no drinking alcohol, no smoking, no citrus or acidic food, and do the salt water. I mean, and that's what makes it so amazing. And for the case it goes successful because the patient do follow through with the instruction. So I appreciate you for following through, for creating a good experience afterwards for yourself as well.
Yeah. Can I speak on like the weight loss also? I have the weight, so at first I was like freaking out, when she was like, you can't eat certain things. And I was like, man, I'll go grab like a burger, fries, or, pizza and things like that. And I had already started working out again. And then I was at work one day and somebody said, are you losing weight? I said, yeah, I just been eating like, protein, like chicken or a lot of soup and things like that, potato,
fish.
salad, fish. I've been eating a lot of fish lately. You never know how much fish is out there until you actually you have to eat fish, And then just drinking water, I normally will go get like a juice or Powerade or something. I don't do monster drinks or something like that, but I will just drinking water. And I'm losing my little dad bod, my little gut,
And it's only 3 weeks, right?
Yeah, it's only 3 weeks.
So wait,
the whole 3 months.
And I said, hey, listen, that came as a bonus on top of everything else because you had to change the habit, right? The change of habit of like the extra stuff you were doing, the extra carb that you were on the side, and said, but stick with the protein. And all of a sudden you got is getting healthier.
It's getting healthy. People notice when people start. I was like, oh, you know what? I'm gonna stick this out. Yeah.
You're welcome for the good. I appreciate you for pointing that out.
You know, there's two things in one, right?
Yeah, and you know, funny thing you said that. I'm going to say this last thing, and I know I said I'm at 12:46, so I'm about to go 1 minute over.
Oh, you're fine.
So I do have another patient, and he's going to be on my podcast later on. He's over 70 years old, and he was going to have a knee surgery. And the doctor was telling him like he needs to lose weight, but he had gone through implants and full mouth rehab and stuff. And his tempers, and I said, these are tempers. You make sure you don't break them. So he has to go through the knee surgery. Anyhow, long story short, because he had to stick with a certain diet and protein and food that I had asked him to, he lost 30 pounds. Okay. And the doctors were asking, what did you do? He's like, I went to my dentist. So there are some benefits of, going through, dental transformation, but also sticking with a healthier diet. I wouldn't say diet because I'm not a really diet person. I'm just saying, like I say, with the protein or things that are good for you, not necessarily the carbs or things that are crunchy and stuff like that. So, but as a result, the patients get the benefit of it. So.
Exactly.
So I appreciate you for bringing that up.
No problem. No.
Thank you.
Could I say one more thing?
Absolutely, you can say.
I just had to just come to my mind real quick. So, like, go to the dentist. If you don't want to be, I know everybody's taking the little shots and doing things for weight loss. You don't want to be doing all that. You got to go to the dentist twice a year for cleanings and things, but you might have some other cares or needs that you got to do with your mouth. Go to the dentist, you can lose weight as well. So, some of the Millennium Smiles. So.
Because you were talking about how if you especially getting implants or full mouth rehab, you gotta do things a little bit differently for things to go so well, and you have done so as well. So yeah, because those weight loss things over time, it really doesn't really stay.
Yeah.
So you want to have a lifestyle change, and for you, I believe you have now made it your lifestyle.
Yeah.
Yeah, which is great because once you do something for 21 days, it will become a habit.
Yeah. And I still got a couple more months, so I'm going to do this for a couple of more months and just try to make it part of it. So.
Sir, you're welcome for that too. Stay tuned, you guys. I appreciate you so much again, Chris, for coming in our podcast. And I know it was a 2-day notice, but I appreciate you. I know dear Kevin comes in here twice a month, and I thought, what would be a great time if I can get you in along with, I believe Carrie's here, one of our great patients who also received extraction, all the lower teeth and all on X. And so she has a whole story to talk about as well.
Right.
But thank you so much. Appreciate you for coming on our podcast.
Thank you for having me.
Of course. And I'm so proud of you for bringing your copy plans, for following the instructions, for the great smile, for the experience that you shared with us. And stay tuned, because I may have him bring back the podcast a year or two from now when your actually entire work gets completed.
Oh, great.
Yeah.
I'd love to be here.
Oh, my gosh. Right. Well, thank you so much.
Thank you.
Have a nice day.
You too.
And stay tuned for another episode of Tea Time with Dr. K.
Thank you.
Thank you.